Cancer is not a death sentence. It is a major inconvenience. That's all it is. It's a pain in the butt. Doctor tells you got cancer. It's no big deal. You're not going to die. The only way you're going to die if you get harsh chemical treatments. You got to get rid of that anger, because that anger makes you acidic, and acid feeds the cancer. My name is Dr. Bernardo. I'm a naturopath. I've been in medicine for 60 years. The last 40 years I've devoted to stage 4 cancer, primarily because my doctor friend said there was no cure for cancer. My practice on cancer is based on the work of Dr. Otto Warburg, a German scientist who was brilliant and proved after several thousand experiments that the only cause of cancer was a 35% hypoxia. That means a 35% drop in oxygen in the body. Now, women that get breast cancer because most of them are angry at men. It has nothing to do with genetics. It's got nothing to do with chemicals. It has to do with internal anger or a strong negative emotion. What we have to do is make them aware that cancer is not a death sentence. The death sentence normally comes from some of the treatments that are currently available. In the future, 30, 40 years from now, this will be known as the dark ages of medicine. The body will heal itself. As Dr. Otto Warburg proved, the only cause of cancer is a 35% drop in oxygen called hypoxia. It's this hypoxia that causes cancer to become active. Now, where do we get cancer? Cancer is carried in the sperm. When the sperm fertilizes the egg, the job of the cancer is to fertilize the egg. The egg will divide and multiply till you get an embryo or a fetus. That's the only job of cancer. After that, cancer is just another harmless parasite in the body. Later in life, when people become acidic and the oxygen drops by 35%, and this can be due to strong negative emotions. Pancreatic cancer has always been my experience, is due to a lot of anger. Breast cancer, as I said, is due to internal anger, mostly at men. This causes the body to become acidic. The cancer patient pH will be anywhere from 5.5 to maybe 5. At 4.5, the cancer patient will die because his body is in acidosis. Like, you can remove all the tumors you want, you can do all the surgeries you want, but you have not corrected the condition. The condition is acidosis. You take your saliva pH, put a piece of pH paper on top of your tongue, suck it for 5 to 10 seconds, take it out and compare it to the chart. And what happens? It's yellow. That means your body is in acidosis. We have to raise the pH. When cancer patients go see their doctor says, well, you've got cancer, we got to do surgery right away, we got to remove the tumors. Removing the tumors does not get rid of the cancer. The cancer is in the blood. On the pinhead, you can park 50,000 cancer bacteria. You've got about a gallon of blood. How much cancer bacteria do you have? Okay? You have to get rid of the acidosis. I don't care how many operations you have, how many margins they've cleared, you still have cancer because it's in the blood. And you can prove this by checking your saliva on a daily basis. When people come to me, their pH is 5, 5.5, and I stress to them we have to raise the pH. And the way we do that is by giving them green juices. Asparagus juice, wheatgrass juice, vegetable juice made out of certain vegetables. The cancer patient cannot have any fruit, with the exception of berries, Granny Smith apple, a little bit of pineapple, and grapefruit. We recommend giving the patients antioxidants, mushrooms, teas to raise the pH, teas to help reduce the cancer concentration, and pills to raise the killer cells, T lymphocytes, and the rest of the immune system. You have to build up your immune system to get well. You have to get rid of the acidosis. That is primary consideration. If you get rid of the acidosis, your pH will go up 7.2, 7.4. You keep it there 3 to 4 months, and believe it or not, in most cases, the patient is in remission. Doctors have said when the patient got well and went in remission, well, I have to admit I had nothing to do in putting you in remission. You did it yourself with whatever program you went on. I don't want to know what the program was, but you were successful in getting rid of the cancer. When most patients hear the word, you go to the physician and say, well, my dear, you got cancer, you got breast cancer, we got to remove your breast right away. Negative. Don't listen to that. Get 2 or 3 opinions. I've had many women come to me with all sizes of tumors, as small as a pea to as big as a small lemon or a peach. They did not have to have their breast removed. You have to get rid of the acidosis, as I said. Do not be afraid when they say, well, you got cancer, we've got to have surgery right away, we've got to do a hysterectomy, or we've got to remove both of your breasts. I tell patients, get a second opinion. And I advise that they go to a woman doctor. Most women doctors have a little more sympathy than men. Unfortunately, most physicians, and I'm talking almost 80%, in my experience in 60 years in medicine, that most doctors are in it for money. That's about 80% of the physicians. It's sad but true. The pharmaceutical companies, they want you to use drugs. I have never used a prescription drug in my life. And I will be happy to teach anybody my program, and they can see that their body will heal itself. When you have a broken arm, the body heals itself. When you burn your skin, the body heals itself. God made it possible for the body to heal itself. But why do you have cancer? You're in acidosis. I've had people that come in, they've had 6 operations. When the doctor goes, well, if I do one more, the patient will be in remission. Nonsense! You cannot go in remission unless you get rid of the acidosis. Dr. Otto Warburg proved this. He spent his entire lifetime, was awarded 2 Nobel Prizes. So this is what we do. We take the patient, stay home. Take your teas, take your supplements, take your antioxidants. Go to your doctor. Get to one of the younger doctors, because the older doctors have a closed mind. Their opinion, only chemo, radiation, surgery will save you. It's not going to save you. Might prolong your life, but it's going to be a miserable life. Look at all the cancer wards where the people have radiation and chemo. Look like a death camp, for God's sakes. So don't be afraid when they tell you, well, you got cancer, we got to have surgery right away, blah, blah, blah. I've had women come in here, we got to do hysterectomy right away, right away. And I said, let me look at the pathology report. What's it say? Abnormal cells. Abnormal cells means nothing. Probably 60, 70% of women have normal cells. It's lack of selenium, lack of zinc, lack of vitamin C, lack of vitamin E. Just the pure antioxidants. If you eat more vegetables, more fresh juices, your body will repair itself. Cancer cannot utilize sugar, so it converts the sugar to lactic acid. So how can we tell how effective the cancer is, or how strong how strong the cancer activity is? We can do that by measuring the lactic acid content. When cancer patients come to me, their pH is 5.5 or 5. At 4.5, the cancer patient will die. So our job is to raise the pH. when cancer cannot use, because cancer cannot use sugar, it converts it to lactic acid. When we take pH paper into our mouth, we're checking the amount of lactic acid your body's producing. And this correlates directly to the amount of cancer activity. The higher your cancer activity, the lower your pH, which means your pH will be around 5, 5.5. So by taking the green juices, you start reducing the lactic acid. And you must prohibit the cancer patient from taking any fruit, because fruit is converted to sugar, sugar is converted to lactic acid, and that's the food for the cancer. So what we do, we allow only 5 fruits: Granny Smith apple, raspberries, blueberries, blackberries, and cherries and strawberries. Those are the only fruits we allow. Those are acidic, with exception of the Granny Smith apple, which is neutral. As we reduce the sugar concentration, the lactic acid begins to go down. When the lactic acid goes down, the pH goes up. So lactic acid goes down, cancer activity is going down. Let me repeat that. When the cancer activity is going down, your pH is going up. So you come in with pH of 5, cancer activity is very, very high. You start taking your green juices, cancer activity is being reduced. That means the lactic acid is being reduced. As the cancer lactic acid food is reduced, the pH begins to go up. Your pH goes up, it indicates your cancer is going down. I've seen doctors say, well, we've given you chemo, now go home, eat a lot of mashed potatoes, steak, butter, and then come back when you get stronger. What they're telling them is go home and eat cancer. White bread, potatoes, gravy, all that makes sugar. Sugar makes lactic acid. So they're in complete, they have no knowledge of the pH system. They have no idea. I've had many oncologists say, well, what the hell does the pH have to do with cancer? There's no sense. You cannot educate people whose mind is made up. They have no idea, have no clue. So what I say, always get a second opinion. Doctor tells you got cancer. It's no big deal. You're not going to die. The only way you're going to die if you get harsh chemical treatments, because it wipes out your immune system. We all know people that had 1 or 2 shots of chemo and they died, or they went up in intensive care for 60 days. The Lord gave us the seeds, the herbs, the oils, the teas, and the herbs to take care of our body. He didn't say, I'll give you the AMA, the FDA, and the pharmaceutical companies to get rid of your cancer. When women come to me with cancer, the first thing I say to them, what has caused you to have cancer? Is it your boyfriend? If it's breast cancer, I always know it's a man. I said, okay, who's the culprit in your life? And they said, no. I said, don't play games. I'm not a diplomat. Who gave you cancer? Go back 8 years from today and you can pinpoint the day that it happened. Well, my husband left me for an 18-year-old girl, or I found out my husband cheated with my sister, or things like that. Let it go. It happened many years ago. Let it go. To me, if your husband is unfaithful or he's causing you problems, get rid of him. Men are like taxis. Get rid of him. Don't like the ride, get another ride. So I tell women, you hate this guy? Yeah. All right, here's what to do. You got to get rid of that anger, because that anger makes you acidic, and acid feeds the cancer. Let me repeat that. The anger makes you acidic. The acid feeds the cancer, which causes a drop in oxygen called hypoxia. So I tell women, I'll show you how to get rid of the anger. Well, there's no way. It's easy. Listen to me. Go get a picture of the person that's causing this cancer, your husband, boyfriend, boss, whatever. Go down to the mall. Get his picture, put it up on have him blow it up on a T-shirt. Then go buy a big pillow and go buy a baseball bat. And then put the T-shirt over the pillow and take it where you want to hurt him the most and get your baseball bat and beat the living crap out of him. People say, well, I think you're crazy. I say, yeah. But once they start doing it, they call me and say, oh, Dr. Bernardo, I feel so good. One woman even told me, by God, I was almost close to an orgasm. I felt so good beating them up like that. You got to let go of the anger. It's water over the dam. All it's going to do is kill you. I've had a woman die because she wouldn't get rid of her anger. I said, it's been 10 years, for God's sakes. What's the matter with you? Well, I can't let go. I said, well, you'll die. And she died in 3 months. So negative emotions, death in the family, a death of a loved one, death of a child, all those are strong negative emotions causing hypoxia. Hypoxia feeds the cancer. That's very simple. Get rid of all the negative emotions. If it helps you to pray, pray. If it helps you to talk with a friend, friend. Get rid of the negative garbage. Get rid of it. You worked, you got a hostile employee or your boss. Get over it or change position. All this will make you hypoxic. The more hypoxic, the more acidic. The more acidic, the more the cancer grows. I have every type of patient in the world has come to me. Brain tumor, lung cancer, breast cancer, pancreatic cancer. And what happens? They get on the program. Those that follow the program religiously get well. And I have many testimonial letters that prove what I've been saying. Like I said, I've been doing this for 60 years. Last month, 60 years on the 16th of April. And I've devoted my life to saving lives. Because as a young man, as you know, I went to Korea. With 4,000 other medics, a year later, only 7 of us came out. And I made up my mind that I would never let anybody die in my presence. And I've stuck to that. People say, well, maybe this guy's wealthy. I'm not wealthy because when people come to me, they had no money. I still treat them. I have never turned anybody away. To turn somebody away because they had no money, in my eyes, it's criminal. 12 years ago, I had prostate cancer. All my nurses were crying. They had not given me the results of the blood test. They had seen it before, and they were all crying. So I said, why are you girls crying? And they wouldn't answer. I said, damn it, why are you crying? What's the matter? He said, well, you got cancer, you're going to die, and we're going to lose our job, and nobody pays us as much as you do. I said, if I cannot get rid of my cancer in 30 days, I deserve to die. And in about 30 days, it was gone. My PSA at that time was around 42 or so. So cancer, it's not a death sentence. On my cards, I put on there, cancer is not a death sentence. It is a major inconvenience. That's all it is. It's a pain in the butt. It makes you aware of certain things. It changes your priority in life. The stuff of going shopping every day and accumulating possessions. Possessions are for fools. What matters is that you love somebody and that love is reciprocated to you.